Today I'm going to talk to you about hip height discrepancies. So almost every single client that comes in to see me, when I assess them, they have a large discrepancy from hip height, which you can assess very quickly just by standing behind the client, have them stand in normal, comfortable, static posture for themselves. Make sure you have their shoes off. Put both hands on each ilium and see if there's a height discrepancy between the two. If there's there should be a quarter-inch difference or less between each side. This is going to be very rare you'll actually see that. Most of the time when a client comes to see you, they're going to have anywhere from a 1 to 2 inch difference between the height, in my experience. Now, there's lots of different reasons why they're going to have this difference, but today we're going to talk about the important things you want to avoid to decrease risk of injury if the person has greater than a quarter-inch difference from one height of the ilium to the other. So if you stop and think about it, if you have one hip higher than the other, what position is the spine in? So right away, as soon as one hip is higher, you're going to start to see a little bit of lateral flexion in the spine, especially through the lumbar spine. And think about what position this puts the discs in. So you have all your vertebrae kind of stacked on top of each other, and if you have some that are going to lateral flexion like that, you're pushing the disc out towards the side. This is going to increase the risk of disc herniation, putting nerve root pressure, which can cause, of course, pain down through the back of the legs, and also going to increase the risk of SI joint injury as well. So you think about the position it puts your SI joint in as well when you have that hip height discrepancy. So as soon as I see a client that has this difference, right away I don't want to do any loaded two-legged movement. So I'm talking about doing no loaded squats, no loaded deadlifts. Doesn't matter the variation or what type of load you're using, whether it's dumbbells, kettlebells, barbell. All these are going to increase risk of back, knee injury, and a lot of different other orthopedic issues. Now you might be thinking, wow, that eliminates huge bulk of what exercises you can do with a client. But the thing is, once you learn how to assess this and you figure out what's causing the hip height difference, it shouldn't take you more than about 1 to 3 weeks with 90% of your clients to clear this hip height difference up, where you can actually get the hips back leveled out and they can start safely performing those exercises without that increased risk of injury. In the meantime, while you're correcting those imbalances, you can focus on doing lunges, one-leg deadlifts, one-legged squats, which will decrease the risk of injury to the back because you're doing one side at a time. You don't have to worry as much about that asymmetry. So check out your client's hip height. Make sure it's a quarter-inch difference or less to make sure that they can be safely performing all those exercises.